Welcome to the Glenn Mercer Show, where we talk all things vegan. If you're not already vegan, no worries, we'll get you there. If you are, tune in for health advice, information on climate change, and all the damage done by our most destructive industry, animal agriculture. We'll also talk cooking, theater, film, and culture. My 2 reasons for starting this podcast: to entertain, to inform, and to make people vegan. Oh, that's 3. Shit. Welcome to the Glenn Mercer Show. You could find us across all your favorite podcast platforms. You could find us on YouTube. And please remember to subscribe. It costs you nothing. And you could find us at realmeneatplants.com. This episode is actually a recording of an event that was done last summer with me and Dr. Michael Klaper. Dr. Klaper is something of an icon in the plant-based movement. He has been teaching patients and doctors how to use diet therapy for decades now. And this is an episode called Own Your Health: How to Make Optimal Use of Medical Care and Otherwise Take Your Health into Your Own Hands. So enjoy the show. This is the plant-powered passport from last summer, the summer of 24. Thank you. We're going to be discussing today the concept of owning your own health. And our special guest is Dr. Michael Klaper. Dr. Klaper is something of an icon in the plant-based movement. He's been practicing nutritional therapy, plant-based medicine for some 40 years, and he's got it right by now. You can find out more about Dr. Klaper and his Moving Medicine Forward initiative. He's the founder of Moving Medicine Forward, a nonprofit dedicated to making sure that future doctors actually practice with an understanding of nutrition. So his websites are movingmedforward.org and Dr. Klaper, spelling out the word doctor, drklaper.com. Everybody should check out on movingmedforward.org. There are some videos, including one called What I Wish I Learned in Medical School. And that's a wonderful video to watch. So our subject today is how to take your health into your own hands, and what's the proper role of a doctor in all that. How much should you rely on doctors, and how much should you just rely on yourself? And so I'm going to be talking for about the first 10 minutes or so, and then we're going to lean on Dr. Klaper's wisdom and experience, not to mention his medical license. So I want to talk for the first 10 minutes about my experience with my hernia and how my hernia almost killed a cardiologist. And so I'm telling you this story as an example of how to take control of your own health. All right, so the plant-based, the whole food, low-fat, vegan diet, we know will help prevent and reverse heart disease, type 2 diabetes, hypertension, and any number of other medical conditions. However, it does not stop you from sneezing your way into a hernia. So that's what happened to me about 1.5 years ago. I sneezed, I said, ow, and then I discovered that I had developed a hernia, a little bulge in my right inguinal canal. What actually happens is some of the bowel actually protrudes. It's not a nice thing to think about. So I started Googling hernias to see what to do about it. And the only solution in this case isn't lentils and vegetables. The solution in this case is surgery. It's the only thing you can do about it. Or you just live with it, or do what they call watchful waiting. So I Googled the surgery and I thought, oh, this will be easy. Hernia surgery, very minor surgery. Everybody, millions of people have it. It's no big deal. But I discovered that it was actually far more complex than I thought. And I discovered that the surgery is almost always done now with mesh, a plastic mesh used to keep the repair in place. And if you Google hernia mesh, you will find that there are hernia mesh lawsuits. You will find that there are people who say that they're living in terrible pain because of the mesh. I don't want to scare anyone. If anyone is listening who had a hernia mesh repair, I'm sure 99% there's no problem. But occasionally there's a problem. So I was a little leery about the hernia mesh, and I read about it. And then I made an appointment with a local surgeon. And I asked him what type of surgery he would be doing. And he said laparoscopic surgery. That's when they make an incision in the abdomen, a couple of centimeters above where I had the problem in my groin. And they, I guess, use robotic arms to do this kind of surgery and put in that mesh. And I asked him why he used the mesh. And he said, lower chance of recurrence. I said, how much lower? He said, 50% lower. So that sounds pretty significant. 50% lower chance of recurrence if you're going through the trouble of having surgery. But I knew how this could be tricky. So I said to the doctor, 50% lower, is that in relative terms or absolute terms? He said, well, I guess relative terms. I said, well, put it in absolute terms for me. He said a 1% chance of recurrence with the mesh, 1.5% chance without the mesh. See how that's a 50% difference? 1.5 is 50% more than 1%. Or you could say it's a 1 out of 200 difference. It's a 0.5 difference in absolute terms. So it doesn't sound so significant when you put it in those terms, and then you have to factor in something else. Either way, you could have a recurrence, right? And if you have a recurrence, and you've already got mesh inside you with tissue growing all around it, that is a very serious and difficult repair. But if you have a recurrence when you don't have the mesh, it's a very simple operation. So he didn't tell me that, but I figured that out. And then there's another factor. When he tells me 1% versus 1.5%, what's he basing that on? He's basing that on the American population. Those are the statistics of the American population. Well, the American population is about 75% overweight. 40% of those are obese. 40% of the population is obese, 42%. So if you're obese, you're more likely to put stress on a hernia repair, and it may recur. I'm 142 pounds, so for me, the odds are lower. One other factor, the most important factor probably in whether or not you have a recurrence isn't whether you have mesh or not. It's how skilled your surgeon is. If you have a skilled surgeon who's doing these surgeries all the time, has years or decades of experience, much lower chance of recurrence. So I Googled a doctor who would be willing to do the repair without mesh. I found one in Sarasota, Florida. And my wife and I drove to Sarasota for the surgery. He does 2 different types of non-mesh repair. By the way, I have an interview with this doctor, Dr. Jonathan Eunice, on my YouTube channel. Please go to my YouTube channel and subscribe. And so I did an interview with Dr. Eunice, and you can find out all about, more about hernias than you'd ever want to know. But in any case, I asked him what type of repair he would be doing, which of the 2 techniques, and he said he'll know when he opens me up. So in other words, not only does he know surgical techniques that the local surgeons don't know, but he is going to make a decision to do what's best for me after he opens me up. He's going to call an audible, as it were. Now, the type of surgery he was going to do and did do is called open surgery, where he just cuts me open in the groin and repairs me there, rather than laparoscopic, where they cut you open in the couple inches higher. There are risks to laparoscopic surgery. One is that you're compromising your abdomen wall. You could wind up getting a hernia there in the future. And then they blow up your belly with carbon dioxide gas. And let me tell you about some of the risks to that. Now, again, it doesn't happen probably to 99% of the people, but it could perforate the bladder when they do the laparoscopic surgery. There could be injury to the spermatic cord. There could be nerve injury. There could be something called testicular atrophy that I was scared to Google. So there are all kinds of problems that you can have if you're doing a more complicated surgery, laparoscopic surgery. In this case, he's just doing what's logical. He's cutting me open in the groin and repairing me there. The risk to the open surgery, I was told, was more pain, longer recovery time. Well, he did the surgery, as I say, he's a highly skilled surgeon, and I had zero pain. I didn't have to take an aspirin. So that risk was not real. One reason, perhaps, if I could give myself a little bit of the credit, most of the credit goes to the surgeon. One reason, perhaps, that I had no pain was there's very low inflammation in my body. And there's very low inflammation in my body because I'm on the whole food, plant-based diet. Whereas a hernia is not something that really, you can't prevent it with a proper diet, but it helps to be on the proper diet because then your weight is optimal and there isn't inflammation in your body, and those things help predict success in the surgery. So I had a very successful surgery that way. And I'm sure most people, have they just gone to the doctor and the doctor says, we'll be doing laparoscopic surgery and there's less chance of recurrence, and people would just accept that. What I want to suggest to you is don't always just listen to your doctor, research it, especially when there's surgery involved, and make a more informed decision. So now I want to bring Dr. Klaper in, and I guess my first question would be, Dr. Klaper, did I handle that one right?
Yes, you did, Glenn. Good to see you. Good to be on this podcast with you. And yes, I really have to commend you and commend to the audience the wonderful example that you said, how Glenn is an educated consumer, so to speak, of medical care here. And he, one, realized that it's only him on that operating table. He's got to really take responsibility. And two, asking the right questions is really key. And if you caught a couple levels of questions there, that I think it sounds sophisticated, but really isn't. He asked the difference between what's the relative risk and the absolute risk. And that's really key, because they're certainly not the same. The relative risk is a percentage. And as you heard, if you you can't give you the specific readout on the numbers here, but if you've got to treat 5,000 people with a given therapy, and as a result, in the group that you treat with whatever the therapy is, a particular type of surgery, whatever, there's 2 people die from the procedure or the medicine, and in the control group, only 1 person dies. Well, that's a 100% difference there. But really, you're just talking about 1 person in 5,000, and that's the absolute risk. So Glenn asked about that, and the absolute risk was tiny, as you know, the difference between 1.5 and 1%. So that's always worthwhile, because when you see the ads on the television commercials in the evening around dinner time, and they say 50% clearer skin, 50% fewer migraines, whatever, you have to say, That's the relative risk. But how many people do you have to treat, and how many people really got that benefit? And you may find out that the difference is just tiny, that they're using the relative risk as a marketing tool. So there's one thing he did that was very wise. And then he did his research. When the doctor first said laparoscopic surgery, he didn't say, okay, went home and looked up laparoscopic surgery to find out what is really involved. And as an old anesthetist who's given lots of anesthetics for laparoscopic surgery, it's a wonderful technique, and thank heavens for it. And the surgeon is able to enter the abdomen with a tiny little keyhole incision instead of filleting open the whole abdomen. And for a woman bleeding from a ruptured ectopic pregnancy, or a chronic abdominal pain where they need to pop in a laparoscope and have a look around, it's a wonderful procedure. They can take biopsies, free up adhesions. Don't be afraid of laparoscopic surgery. But when in this one case, when it comes down to, well, you needed to repair a hernia, now, as Glenn properly displayed, there's pluses and minuses that need to be weighed. And it's common sense said, why don't you just open up the hernia, suture it up, and close it up, and without having to involve all the other abdominal organs. And on this one, he was right. And so I really commend Glenn for taking the responsibility in his own hands, and also doing the research to find out, you know what you're talking about. And Glenn, in this case, certainly knows what he's talking about. So he absolutely did the right thing.
All right. So I'll chalk up a win on that one. By the way, now I have developed a hernia on the other side. The good news is I have only two sides. So this is it. There's just one more. But what happened was the doctor couldn't determine conclusively that it was a hernia. Now, I knew it was a hernia because I know what they look like now. But he said, go for an ultrasound. So I went for an ultrasound, and the ultrasound couldn't find it. So he said to me, you're going to have to go now for a CT scan. I said, you're kidding. You brought me to get radiation, a CT scan? I'm not doing that. The problem is you do a CT scan. This is what they call over-testing, over-diagnosis. If they did a CT scan, oh, I forgot to tell about how I almost killed the cardiologist. I have to get back to that. If they did a CT scan, there would be a risk that they'll say, oh, it's a hernia, but also we found something else. We found a little dark spot somewhere. We're going to have to do a biopsy or testing, and they'd make me miserable. I don't believe in looking for problems. So since I knew it was a hernia, I wasn't going to do a CT scan. And now I waited a few months, did another ultrasound, and this time they found the hernia. But I promised I would tell about how I almost killed the cardiologist with this, and I left that part out. So just to not to forget that, before I got the surgery, I had to get approved for anesthesia. So I had to have an EKG to make sure my heart was sound enough for anesthesia. So I had an EKG. I'd had several EKGs before in my life and always passed, but this time I failed. I've got an abnormal EKG because I have bradycardia. Dr. Klaper, could you explain, does bradycardia, a slightly slower heartbeat, is that related in any way to the plant-based diet?
Possibly, but in a good way. Brady means slow. B-R-A-D-Y means slow. And it can be a sign of heart disease, of a conduction defect in the heart or whatever. It should be looked into. But the reality is that people on whole food plant-based diets, their blood is less thick, it's less viscous, it flows more easily. And the heart very often, if the person's otherwise healthy, not obese, can perfuse the body with fewer heartbeats per minute. And it's often a sign of wide open arteries and free-flowing blood, and a heart that doesn't have to work very hard. So it's not necessarily a sign of heart disease, certainly not a reason to put off surgery. But may want to talk to a cardiologist, but if they put a stethoscope in your chest and you got a healthy heart there, it's a benign finding. And not
there you go. And the greatest athletes in the world have low heart rates, right? 40 beats per minute or something like that, right?
The hearts are so strong, they only need to beat 40 times a minute to
Right.
control
So when I got this finding, I said to them, it's not a problem. It's that I am an Olympic level athlete. And they didn't buy that. So they said that in order to get the surgery now, I would have to have an ultrasound of my heart. And there are no risks to an ultrasound. But I was nervous about it. And the reason I was nervous about it is I know people who have been told that they have a heart problem, they have a leaky valve or something. What if they told me I had a leaky valve? And then they would say, well, we're not going to operate now, but we're going to have to test you every 3 months for the rest of your life. And you may need emergency heart surgery. And, I don't like looking for problems. I'm not having a problem with my heart. Why do I want to scan it and look for problems? That's just my perspective on things. But I had to do it in order to get the hernia surgery. So I thought I'll try calling a cardiologist I know, retired cardiologist, and ask him, is there some way I could get approval without doing this damn scan and risking being told something I don't want to know? And I explained to him my reason for not wanting a heart scan. And he said to me, Glenn, if you have heart disease, don't you want to know about it? And I said, of course not. And then there was silence on the line, and I heard, and I thought I killed him because the thought, he had no, when I said, I don't want to know, I mean, that just devastated him. But that is my perspective. My perspective is, unlike people who eat the standard American diet and bring on disease and then test themselves to death, my approach is do everything I can to keep myself healthy, try to, get some exercise and try to get some sleep and eat a whole food plant-based diet. And then don't go looking for problems. And so I wouldn't want to know if I have a problem until I feel it. If I feel a symptom, then I check it out. But if I don't, I'm not going for a full body scan tomorrow to see if there's some problem lurking in my body that I don't know about. Dr. Klaper, how do you feel about it when people go for full body, they're feeling fine and they decide I'll go for a full body scan?
Well, as you're applying, Glenn, there can certainly be a double-edged sword here. And, on one side, way over is the ignorance is bliss. I don't want to know anything about anything. And on the other side is the person who wants everything scanned and leaves themselves open to finding all sorts of anomalies in the body, most of which are benign, but it sets off these endless chases of biopsies and invasive procedures, etc. So where's the happy medium in between those? As Glenn said, if you've got symptoms, if you've got chest pain when you walk or pressure in your chest or your heart is going thumpity, 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 thump, get that checked out. You are symptomatic. And there's no question, I'm sure Glenn would go along with that. But there's an old adage in medicine when it comes time to order tests. I had my chief medical resident says, if you're going to order any test, no matter if it's the simplest dipstick urinalysis to the most invasive carotid arteriogram, whatever test you're going to order, ask yourself this question, or here's the principle. If it's not going to change your treatment, don't order the test. Now, don't generate the expense, don't generate the worry in the patient's head, don't generate the call on your time to explain normal results. It's not going to change. If you're already doing whatever it is you would do, no matter what the findings on the test, don't order the test. And that's the philosophy that Glenn is saying. He's already on a whole food plant-based diet. He's already walking. He's not a smoker. He's not obese. He's doing everything that one can do to avoid coronary artery disease. And he has no signs of it. Is it worthwhile doing a screening test? As he said, the risk, of course, is finding, as we in the medical biz say, you find an incidental oma. Oma means a lump there. There's an incidental oma. Incidentally, we found and that occasionally proves to be life-saving. I'm not saying that there's never any benefit to that, but it often, as I said, generates a lot of false positives. So again, before you defend getting a test or not, are you already doing everything you can possibly do to prevent disease X, whatever you're talking about? And if you are, then the necessity for getting a test, the factors you have to weigh change. But again, it depends on everybody's personal situation. So should a woman get a mammogram? Depends on the woman. If she's a 50-year-old woman and her mother, two sisters, and an aunt all died of breast cancer at age 50, she's clearly at risk, and she should get screening mammograms from time to time that she and her doctor agree on the interval. Colonoscopies. If a guy has his father, two brothers, and an uncle all died of colon cancer at age 48, he's clearly at risk, and he probably should get a colonoscopy and be followed fairly closely. But the flip side of that, the person who is, again, for 20 years, they've eaten a whole food plant-based diet, they've checked their stools, never been any blood, they had a colonoscopy X number of years ago, no polyps, nothing found. Does this person, and again, no cancer in their family history, is this person at a high risk for colon cancer? No, he's not. Clearly, he's demonstrated that. He's already 50 years old. Does he need an annual colonoscopy? No, I wouldn't think so. Nowadays, with these Cologuard tests, they can check for cancer DNA in the stool. That certainly could reduce the necessity to actually do a colonoscopy. But if I were in that category, and I am, in other words, no colon cancer in my family, I've eaten a whole food plant-based diet for 40 years, I've never had any blood or anything in the stool. I had a colonoscopy about 10 years ago. I'll get a Cologuard once or twice. I'm in my 70s now. They're not even I'm there. I've already passed the age where I'm worth salvaging anyway. There's after age about 70, 75, stop screening anyway. So I've already passed it. So again, everybody's got to decide on themselves depending on their family history, their diet. And if you're still eating meat, you're still eating processed food, and you're still smearing carcinogens on your colon wall a couple times a day, then you are in the average risk category of the average American, and you should pay some attention there. So again, get on that whole food plant-based diet, and you'll be in a much stronger position to decide on these individual tests.
Right. Now, when they do research on whether colonoscopies save lives, they they look at the risks and the rewards, and a certain very, very small percentage of times the colon is perforated, and that's a real problem. But I don't know if that's 1 in 10,000 or whatever. It's a very, very low risk. And they feel that they save enough lives to justify that risk. And I don't question that, except that they do those tests on the general American population. So I always feel that when I look at studies like that say, risk-reward ratio shows benefit to colonoscopies, whether it's annual or once every 5 years or whatever, there should be an asterisk there that says, in studies on the general American population. Right. It doesn't necessarily apply to us.
Right. Every time you cook meat, every time you put that steak under the broiler, put the burger on the grill, drop that chicken carcass into a boiling fat, every time you cook animal muscle, you're going to oxidize the glycogen nucleic acids, or you're going to create cancer-causing substance. You're going to create carcinogens. You can't cook meat without creating carcinogens. So if you're eating meat, you're smearing carcinogen on your gut wall X number of times a day, whether it's the bacon at breakfast, it's the burger at lunch, the chicken for dinner. And if you're constantly smearing carcinogens on your gut wall, the odds of you getting a malignancy are certainly higher than the person not doing that. When you steam broccoli, you don't generate carcinogens. When you cook rice, you don't generate carcinogens. And so if you are still in the omnivorous camp of diet selection, you are putting yourself at risk, and these studies have gravity for you. But in a population of vegans, especially people who've been raised as vegans since birth or have been plant-based since their teen years and they're now in their 40s, again, one colonoscopy maybe, and if that is stone cold negative, boy, it'd be hard to press the case to be getting one every 5 years. Again, followed with the Cologuard for a decade or two. And, it's just not going to happen in that person eating a whole food plant-based diet, as far as I can see.
Okay. By the way, if anyone in the audience has questions, you could put them in the chat. I want to relay the story of my wife who discovered that she had bad reactions to eating gluten. So she stopped eating bread with gluten. She stopped eating pasta with gluten. She cut gluten out of her diet. She was having some autoimmune reactions, some joint pains, things like that. And we went to a rheumatologist. And the rheumatologist said, well, you've got to check yourself for celiac. Well, how do we do that? Well, the only way to test for celiac that's effective, she said, is you have to eat gluten all day long for a month. Just keep eating bread and pasta and gluten all day long for about a month, and then we'll do the test, and then we'll know if you really have celiac. And I said, now, wait a minute. I'm listening to this utter absurdity. My wife knows that she gets pains when she eats gluten, and the doctor is telling her to torture herself. So I said, let me ask you this. You say the test is much more accurate if she eats gluten all day long for a month. How accurate is it? And she said, oh, gee, about 95% accurate. So in other words, my wife is supposed to make herself miserable for a month, make all her symptoms worse, suffer intensely for a test that still won't be 100% accurate. And then, even if it were 100% accurate, and it told her that she had celiac disease, what would the doctor say? Don't eat gluten. Well, that's what she's doing already. So why in the world would we want to make her condition worse so that she could take a test that at best would tell her to stop doing what she's already stopped doing, eating gluten?
Oh, it's embarrassing. As a physician, it's embarrassing for me to hear that story. And once again, I apologize for a member of my profession who's been unleashed upon the unsuspecting public with an abysmal ignorance. I don't know the doctor, but for that advice to be dispensed, the person clearly has not gotten any formal training in applied nutrition, which is why we're trying to reach the medical students with the message that, one, most of the diseases you're going to be treating for all your career, no matter what your specialty is, these are reversible diseases: the high blood pressure, the type 2 diabetes, the clogged arteries. They're from what the patient is eating, and if you get them on a healthy diet, these diseases resolve. I wish someone had told me that in medical school, but we're telling the students that. And second, a diet of whole plant foods is the key to reversing these diseases. Not the only thing you need to do, but it's square one. If you want to reverse these diseases, stop the meat and the dairy and the oil and the sugars and the processed foods and all the toxic molecules in the standard American diet. Go to a diet based on whole plant foods, and most of these diseases start to resolve very promptly. And no one told her that, and it's not her fault either. But again, these are the practitioners dispensing advice that is counterproductive. We're told do no harm. Well, you can harm someone with nutritional advice, and if someone truly has a gluten sensitivity, or heaven forbid, truly celiac disease, and you smear gluten on that intestine daily for a month, you're really going to cause some damage in the lining of the intestine. And as for what, as you say, is it going to change your treatment, doctor? And no, it's not. She's already doing what she needs to do, namely not eating gluten. And so all the way around, it's a sad state of affairs when it comes to nutrition. It's the worst kept secret in medicine that modern doctors don't know anything about nutrition. So we're trying to change that through our Moving Medicine Forward initiative. If people like to know about it, again, movingmedforward.org.
All right, if you've ever wanted to show off your plant-based lifestyle and do it in style, here's your chance. We have some of the most amazing t-shirts, hats, accessories, coffee mugs, and more at shop.realmeneatplants.com. We have statement t-shirts that will bring a smile to everyone's face. I love the I Want Tofu Tonight tee. Plus, we have podcast tees, Real Women Eat Plants gear, Real Kids Eat Plants, and Real People Eat Plants, just in case men, women, and kids didn't cover it all. Yeah, we love you and love that you want to show off that healthy lifestyle of yours. Again, check out our high-quality gear at shop.realmeneatplants.com and enjoy.
Now, one way that people try to take their health in their own hands is with supplements. And so let me ask your opinion on a bunch of supplements that people take. I take B12, and when I remember, I take D3. I had been low in my D vitamins according to a blood test, so I try to remember to take D3. So would you address vitamin B12, D3, multivitamins, what to do for omegas, whether you believe in DHA supplementation and all that?
Okay. Well, big long wind up here to get this inning underway here. We got to talk about vitamin B12. Yes, it is the only supplemental vitamin that any totally plant-based person needs to consume. When people hear that vegans need to take B12, they say, aha, it's not a natural diet if you've got to take a supplement. But again, to make a very long story very short, vitamin B12, which you absolutely need to take in once or twice a week to keep your brain healthy, your spinal cord healthy, your bone marrow healthy. That vitamin is, yes, it's found in meat products. That's true, but cows don't make it, chickens don't make it, no animal makes it. It's made by microbes that live in the soil. Cows have B12 in their muscles because they're eating grass all day and they're pulling up clumps of dirt that have soil particles clinging to the roots. And in those soil particles are the microbes that create the B12. The cow swallows the microbes, the B12 is produced, the cow absorbs the vitamin B12, goes into the muscles. And yes, you can shoot the cow in the head and strip the flesh from its bones and eat the flesh, and yes, you'll get your B12 that way. But the cow didn't make it. It was microbial B12 all along. And we Homo sapien humans used to get our B12 the very same place. 1,000 years ago, 1,000,000 years ago, our foraging ancestors got most of their calories from starchy roots and tubers, and contrary to the mighty hunter myth that the Neanderthals and the Pleistocene folks lived on mammoth meat. Most hunts were unsuccessful. The majority of calories were gathered by the women who spent all day digging up starchy roots and tubers, and they didn't wash their roots and tubers under chlorinated drinking water. There was soil particles clinging to the surface of the veggies, and when you ate them, you got the same B12 that the deer and the antelope and the cows and the grazing animals get today. So it comes from microbes. Our diet used to supply it when back then our ancestors, when they were thirsty, they would find near a stream and plop down and drink stream water. There'd be B12 in the stream water. The same B12 is flowing through our system when we were living earth-connected lives that the natural animals did as well. But welcome to the 21st century. No one's eating unwashed vegetables. No one's drinking out of streams. And chlorine is added to the drinking water, and it kills bacteria, which is fine with me. I'm not against chlorinating the water supply, and I don't want to be treating cases of cholera and typhoid fever. It's okay to do that. But the price we pay for modern sanitation is that the, quote, natural sources of B12 from our diet have disappeared. And it's for that reason that the modern plant-based eater needs to take a supplement of B12, which is from those same microbes. And so, yeah, once or twice a week, if you're totally plant-based, have something with a few hundred micrograms of B12 in it. It's added to soy milk. It's added to veggie burgers. It's in multivitamins. You can get it in sprays and liquids and sublingual tablets. The vehicle doesn't matter. Once or twice a week, have 500 micrograms of vitamin B12, usually in the cyanocobalamin form. Now we have a spray on it. We put it on my tongue a couple times a week, and be done with it. Yes, it's an artifact of modern sanitation rather than an inherent defect in the vegan diet, as the 21st century vegan diet. And vitamin D, yes, vitamin D is made when sunlight falls on our skin. It's essential not only for calcium absorption, but we now know it's important for nerve function, immune system, immune function, membrane health. You need vitamin D. And we've become so afraid of the sun. Most of us are spending our days inside, and there's very little sunlight falling on our skin anymore. So vitamin D levels are going down. It seems to be a general consensus that keeping your vitamin D level up over 30 nanograms per milliliter is a good idea. So get your B12 level checked. And if it's below 30, then take some vitamin D in some form. I hope I was saying vitamin D. A couple thousand units of vitamin D. There's now vegan vitamin D3. Ought to keep your level pretty within the 30 to 90 range. 30 to 70 range, I would say, is probably the best range. So those are two that I think all modern plant-based eaters should not begrudge themselves, and don't neglect those. Those are important vitamins. All the others should be provided by a diet of whole plant food. All the vitamins and minerals you need to keep your enzymes working, etc., should be found in the salads and the soups and the steamed veggies and the chilies and the curries and the steady stream of colorful vegetables flowing through your system 2-3 times a day, along with the healthy microbiome in your gut that food stream is going to spawn, should provide all the vitamins and minerals that you need, and no other supplements are really essential. People have been living on whole food plant-based diets for thousands of years without taking vitamin supplements. In theory, the food should supply everything. But I travel on the road. We eat out in restaurants from time to time. Some days I get involved in meetings, etc. I only eat once during the day. And so I look at the end of my week, and have I really gotten the zinc that I need? Have I really gotten the iodine that I need for my thyroid? Maybe, maybe not. You can provide, make sure you provide these. They're a little gob of sea vegetables in your salad a couple times a week will provide the iodine you need. But I often don't. I'm neglectful of my own well-being here. And so once or twice a week, I'll take a plant-based multivitamin. Could I survive well without it? Probably. It's got a little zinc in it. It's got a little iodine in it. Got some vitamin D in it. Got some B12 in it. That's mainly what it has. And I don't think I'm doing any harm. I don't think there's any risk in doing that. And I feel better that I've maybe topped up my vitamin D, my iodine, and my zinc level. But really, I think I do fine without them. I just need to eat more salads and more whole grains, etc. But it's in the food. But welcome to the 21st century. I think it's reasonable if one wants to take a very low potency. I've been very impressed with the multivitamins. When I was growing up, 1-a-day vitamin and geritol, high potency multivitamins, and these spectacular doses of 50,000 units of vitamin A, which we now know is toxic to the bone marrow and increases cancer risk, not too much beta carotene, etc. We learned all this the hard way. And I've been encouraged that most of the vegan multivitamins now, all the makers, they've toned down the dosages. These are very low dose, modest doses, 150 micrograms of iodine, just 2,000 of D. They become much more modest, so I feel okay about taking a plant-based multivitamin a couple times a week. Again, mostly for vitamin D, zinc, and iodine. Don't think you need vitamin K in it. Your gut will make that. The issue of the omega-3s, I still have not made up my mind completely about it. The lore has it, and every once in a while, I get an article showing that there's a correlation between low DHA levels, these long chain omega-3 fatty acids, that your body can make. But the question, can we make enough for our needs? And one camp says, no, we don't have the enzymes to make all the DHA that we need. You should take some a couple times a week, pre-form, made from algae. And the other side says you don't need that. Your body can make all the DHA you need. Just give it the base omega-3s in walnuts and flax seeds and chia seeds, and your body will make all that it needs. And I wish that was true, and it may well be. I'll get studies. Jeff Palmer, a good man who's a serious student of the subject, sends me articles saying that not only do you not need to take DHA, but it actually inhibits your own DHA production when you take it pre-formed. And I'll get ready to stop taking it, and then next week I'll get an article showing low DHA levels, with a low omega-3 index associated with decreased brain sharpness as the years go by. And so I still am not convinced one way or the other. I take it a couple times a week because when I stopped taking it, my omega-3 index took a nosedive, and I just felt uneasy. But it's a numbers game. I can't say I feel any different when I take it or when I don't. So I'm on the line about that. I'm still waiting for the definitive research one way or the other. Everybody's got to do their own thoughts on their own research on whether DHA is suitable for them. But still, have a handful of walnuts every day on your oatmeal. Sprinkle a tablespoon of ground flax seeds on your salad or put it in your soup, whatever. Give your body the omega-3s that it needs to make whatever DHA it can. So, yeah.
There's an audience question here, but before I get to that one, I want to get to Nancy's question, which is there are... here it is right here. There are plant-based MDs out there encouraging taking 3 tablespoons flax or chia oil per day, along with lots of high nutrient brassica vegetables. So
wow.
I'm guessing you're not going to jump on the flax or chia oil train, but tell us, what do you think?
Yeah, what you just said really summarized mine. These oils, they leap into the bloodstream. That packs a whole lot of whatever it is. And here it's omega-3 fats, but if you're eating coconut oil or any of these oils, suddenly there's a bunch of saturated fats in your bloodstream. So these oils are absorbed quickly. No other animal does this. Is this really a good thing to unleash on your liver, your brain? What does this oil do to your microbiome organism down in your gut there? I don't know if that's a good idea. Again, there's this generalized anxiety about omega-3s, and I think it's overblown at this point. Again, have your handful of walnuts, have the ground flax seeds, but I'd be hesitant to use much oil. A teaspoon of flax oil on a baked potato is fine. But man, tell them a couple of tablespoons of that stuff on a daily basis, that gets to be a lot of oil that concerns me. And what does that do to blood clotting? What does it do to insulin resistance? What does that do to the function of the artery walls? All these oils have pharmaceutical effects that concern me. They're a processed, unnatural food. So again, I think there's a kind of fear-based grasping at a little bit. If flax has it, then let them have pure flax oil. But I think if little is good, more is better. That doesn't apply when it comes to these omega-3s. I think.
Right. Could we have that question back? Yes. What are your thoughts on clinical studies, especially if your condition is borderline to be included in the study? That's a very general question. I don't know.
It is, but again, and Glenn touched on this earlier, just about every study and every clinical study you see, should be, for us plant-based folks, a little asterisk saying whatever the finding is in a population of people eating the standard American diet, running meat and dairy and oil through their arteries 3 times a day. In that population, these findings are, this clinical study shows that. If you're not in that population, if you've been eating whole food plant-based for years, whatever that study is telling you, take it with interest, but it's of the omnivore population. They have a different physiology. They've got a different microbiome. They've got a different liver enzymes functioning. We're different creatures, depending on the food stream we're constantly putting through our tissues there. So not saying the clinical studies have no value, but again, they're for standard Americans, and you need to take that into account to decide whether it's applicable to your particular condition.
Right. And if the person who sent in that question wants to be more specific and let us know what kind of nutritional study and condition you're talking about, maybe Dr. Klaper can give a more specific answer. In the meantime, Dr. Klaper, I'll ask you, what do you think of the PSA test? Is that a test that men should get?
My most unfavorite test in all of medicine. This is a little protein that's released off the surface of prostate gland cells when they're stressed or stretched in any way. And the problem is, of course, that there's lots of things that can irritate prostate gland cells to spill out this PSA that are not cancerous. Yes, a cancer invading the prostate will raise your PSA. It'll cause this protein to spill out in the blood. But so does benign prostatic hypertrophy, just the enlargement of the prostate that guys get. Many of them, again, depending on a diet that's full of meats and oils and fats, etc. But that will stretch the prostate and raise your PSA. If someone's had an infection, a chronic prostatitis, that will raise your PSA. If the urologist did a rectal exam and just pushed on the prostate, and the next day you got a PSA check, well, your PSA might be up just from the exam. It's such a non-specific test that when it comes back elevated, you don't know what to do with it. But the urologists say, well, we know what to do with it. This man needs to lay down on the table, and I'm going to do 12 biopsies of their prostate and look for cancer. And here you get into that whole problem with if it's positive, what do you do about it? Most prostate cancers, especially if the guy is whole food plant-based, are very slow growing, not in need of treatment. Or the biopsies could miss a cancer, though even if it comes back negative, you don't really know that either. It's the worst of medical testing, and the question is, does the biopsy itself, does that raise your PSA afterwards? The fact that they put a needle in your prostate 12 times. So down this the slippery slope you go with this. And so what they need, of course, is a test for prostate cancer per se. They need an actual chunk, and they're starting to get that. It should be an easy urine test. The truth of it is, if your guy's got prostate cancer, the prostate cancer protein should be leaking into the urine, and there's also blood tests now. Within the next year or two, I suspect the PSA is going to disappear in favor of these true cancer tests, cancer detection tests. So I would wait for a year, if it's elevated, talk to your doctor. Is a biopsy really necessary? Can we just do watchful waiting on this one? I would just follow the serial PSAs, unless you know there's an aggressive cancer there. Have an MRI of the prostate done, and then nowadays the imaging is really good. And if there's no mass in the prostate, if there's a cancer there, it's often visible, and you need to get that biopsy. But if they do an MRI and it's clean and clear and homogeneous, you probably don't have a cancer in there. I would just watch that with serial blood tests.
All right. The general question that we got before about clinical studies has now turned into a very specific question. Apparently, it's for a liver clinical study. I believe the drug is called Resemteram, related to cirrhosis of the liver. Phase 3 study related to NASH and Maestro-NASH outcomes. Wow. This is all way over my head. What can you say about it, Dr. Klaper?
Yeah, the NASH is a sign of an unhealthy liver. NA is non-alcoholic steatohepatitis, which is fat has accumulated in the liver cells. Again, largely because of what the person is eating. Well, we learned in the first year of anatomy that the intestinal tract is surrounded with a spider web of veins that absorb the nutrients, and the veins then all join together and form the portal vein, goes right up into the liver. So everything you're eating within minutes is flowing right up through your liver, and it bathes the liver cells. And if what you're eating is rice and beans and greens and fruits and vegetables, yay, your liver can handle that. But if it's full of a bunch of sugar and alcohol and fats and meat and food chemicals, that chemical assault, again, meal after meal, the cells get injured and they accumulate fat. It's a sign of a diet that's been injuring the liver 2-3 times a day. Too much fat, sugar, alcohol, too much protein, etc. So again, a low-fat, whole food, plant-based diet is square one when it comes to reversing NASH, and it's a reversible disease unless severe cirrhosis scarring is set in. The liver can clear that stuff out of there. So get on a whole food, plant-based diet. Go to Dr. Greger's nutritionfacts.org and look up NASH and the related symptoms there. But if you're not on an honest to goodness, honest and whole food, plant-based diet, salads and soups and steamed veggies, etc., your liver's never not looking. It knows everything you're eating. To thine own liver be true, Shakespeare said, or he should have said. And so, make every meal that's coming up through your liver be whole food, plant-based. And the liver should heal itself. Hopefully you won't need these other high-power medications.
All right, we have the link to Dr. Greger's video on fatty liver disease right there. Good job, crew. Now, in response to the last couple of questions about the prostate and the liver, we've learned that a low-fat diet helps protect these organs. On a vegan diet, some people eat a lot of avocados, a lot of coconut. Of course, we recommend against oil, which is 100% fat. But what if people are eating whole foods like avocado, coconut, olives, nuts, seeds, and they're eating a kind of a high-fat whole food diet? They're getting maybe 30% of their calories as fat because they're eating a lot of nuts and seeds and olives and coconut. Is that a risk to the prostate and the liver?
It might be. Again, whole foods beat oils. And this is one reason I'm not thrilled with oils, in that when you eat an avocado or a whole avocado or a piece of a whole avocado or chew up a couple of walnuts, the micro droplets of walnut oil, avocado oil are tightly bound to the fiber of the walnut, of the avocado. And you chew it up, and it takes hours for your digestive enzymes to get into the piece of the walnut, for the amylase enzyme to free up the starches holding the micro droplets of oil, for the lipase enzymes to get in and emulsify the oil, for the oil to get absorbed. And as a result, the amount of oil that gets absorbed from these whole plant foods really is a fairly modest amount of oil. One pass through the liver is pretty much gone. They don't have much of a pharmaceutical effect unless taken in the quantity you're talking about, which I'll get to that. The problem with the oils is that nothing slows down the absorption. These fats leap into the bloodstream and they start having pharmaceutical effects. They inhibit nitric oxide production in the walls of the arteries. They inhibit blood clotting. They increase inflammation in the saturated fats. They inhibit insulin function. These oils have pharmaceutical effects. The whole plant fats don't. And so you can get away with more fat in the diet from whole plant foods. But there comes that point where it's just, that's a lot of avocado, that's a lot of nuts there. So hold avocados to half a piece of fruit a day or less. A quarter of an avocado is reasonable to put on a salad. And whatever nut you're eating or seeds, a small handful, and that's it. Okay, don't sit in front of the TV with a 5-pound bag of cashews and shovel them in there. Whether they're sunflower seeds or whole walnuts, whatever, one small handful, and eat them one at a time, or grind them up into a salad dressing. But if you hold it that amount, then you shouldn't get in trouble. But more than that, that gets to be too much. And everybody's different. Depends, how much fat the intestine really absorbs. Even though you eat the food, it comes a point where your gut may just absorb less because it knows you've got a lot of fat in the bloodstream. So everybody's different on that. But, gluttony is gluttony, even if it's vegan gluttony. Easy does it on these fatty foods.
Let me say to the audience, if you have any other questions, try to put them in the chat in the next 5 minutes, as we'll be wrapping up fairly shortly. I want to ask you, Dr. Klaper, a question about the patient-physician relationship. As a patient is either choosing a physician or deciding whether to stay with their present physician, and the patient is adopting the attitude that I'm recommending of taking your health into your own hands. And maybe you start to feel a little resistance from the doctor, or maybe the doctor encourages you to ask questions and bring in research and that sort of thing. And sometimes you may feel you need a second opinion. And do you tell the doctor, well, I'm going to go for a second opinion? So could you talk to that issue of how a patient should react to a doctor's attitude towards the patient trying to take his or her health into his or her own hands?
Oh, important question, Glenn. Thank you. And a lot has to do with one's attitude. If you're coming in, my doctor's a dummy, doesn't know anything, but here's the latest study showing that XYZ needs to be done. You're going to put the doctor's human, and he's going to, or she's going to close down and get defensive. Doctor's your ally, he's your health coach, or she's your health coach there. So work with them, but they should not be afraid of outside information or other opinions. I welcome people coming in with a list of questions. Please bring in your questions so you don't walk out of the appointment saying, oh, I didn't ask them about whatever. Bring those questions in. And if you have a research study that concerns you, absolutely bring them in. And if a patient wants to get another opinion, I welcome that. I'll learn something from that other doctor. So there should be no friction whatsoever, assuming the patient doesn't have an attitude. If they're sincerely seeking the truth of it, there shouldn't be a problem. If the doctor just is dismissive and doesn't think patients know anything, then it's appropriate to start looking for another doctor. A little clue for anyone who needs to get an opinion from a specialist, no matter if it's a surgeon, oncologist, a radiologist, whoever it is, when you're sitting in front of that specialist, and it's easy to get rattled and frightened, realize you only want the answer to two questions. One, doctor, in plain English, explain to me how my problem looks to you. What do you think my issue is? Through your surgeon's eyes, through your oncologist's eyes, tell me how the problem is from your point of view. And second, please lay out my list of options, from doing nothing and just observing it to the most high-tech invasive. Lay out my list of options so I see what's available to me. As soon as you get the answer to those two questions, what the doctor's seeing and what your list of options are, you are free, with very lovingly and respectfully, stand up, shake their hand, and say, thank you very much. Let me go home and think about what you said, and I'll get back to you when I made a decision. And you're free to leave and go think about what you just heard there. There's darn few true emergencies where you got to sign on the line and go right to the operating room. So you got time there. Ask those two questions. How does it look to the doctor, and what are the options? And then go home and think about it. And you'll be less likely to be pressured into a decision that you might regret later.
All right, here we have the question. How do you suggest people approach the topic of plant-based diets with their healthcare providers, especially if their doctor is not supportive?
Very important. The question, people say, where do I find a plant-based doctor? First of all, one, you don't need one. We'll get to that in a minute. But if you're home working in the kitchen, you cut your finger, go to the local urgent care clinic, get your hand sewed up, and you don't need a plant-based doctor to do that. And most of these things, if you got a lump or whatever, the doctor does a service for you with diagnosis, recommends treatment. They don't have to be plant-based. And if you know that they're antagonistic to it, don't wave the red cape in front of the bull. Don't mention vegan. Don't mention plant-based. If you know that they're dismissive of nutrition in general and plant-based, and vegan is a red flag. Don't wave that in front of them. It doesn't matter. Get the service out of that doctor that they're going to provide diagnosis and treatment. And usually the plant-based issue doesn't come into it. It doesn't need to. But one thing to do if you've got doctors that are all open is to make them your plant-based doctor. And there's go to pcrm.org. They have information packets to give to your doctor. We're going to have one on our website. Nutritionfacts.org has information to take to your doctor, so you can be very respectfully, if you're like Glenn said at the very beginning, as far with his wife, he's already not eating gluten. One thing to do with the food thing, just do it. Don't have to say anything to your doctor. You don't need any permission. Just freaking do it. As far as eating a plant-based diet, take that off the table. You're already doing that. Then see what modern medicine has to offer. So don't get into conflicts. Most of the time, the plant-based thing shouldn't really enter into it. Go plant-based, and you're not going to have the need for a physician of any kind, hopefully, for a long, long time. So don't make it a problem in your relationship with the doctor if you don't need to.
Okay. I have 2 questions left, unless other questions pop up. Brian is, I guess, talking about hernias, where he's saying just don't sneeze. I guess
don't sneeze. Not in front of the doctor. Don't sneeze.
That's good advice. The first is about EKGs. Now, as I mentioned, before I got my hernia surgery, I had to get an EKG, and then that led to a heart scan. Another time, my wife was asked to get an EKG, and they said, it's abnormal. You got to go to the emergency room. And we actually, unfortunately, listened to the jerk, and we went to the emergency room for 6 hours before we got the diagnosis that the tech in the urgent care clinic had misread the EKG. So that was the diagnosis. That cost $1,000. I Googled some information on EKGs and came up with one claim that something like 1/3 of EKGs are abnormal, which makes me feel, is the EKG just sort of an instrument used to generate business? When should you take an EKG, and when should you be highly suspicious of the results?
Right. Again, this is an artifact of our skewed medical system to avoid lawsuits. The malpractice lawyers have their influence here, that everybody's got to get an EKG. Heaven forbid the doctor should miss a silent heart attack, or that may have happened. And welcome to America in the 21st century. It's not so crazy. The truth is, most Americans do have clogged up coronary arteries. And as an old anesthetist, boy, you don't want to find out on the operating table when the heart monitor starts going into ventricular tachycardia because nobody took an EKG and saw this man had a heart attack a month ago and nobody picked it up. I mean, you got to do it, especially if surgery is required. It's a screening test because heart disease is so common. But you're right; it's easy to overread the EKGs. They'll sometimes pick up exotic things that send you down a rabbit hole. That's true. But thankfully, it's a non-invasive test. You just stick some electrodes on the chest there and the extremities. And as I said, because coronary artery disease is so prevalent, 1,000 people a day die of this disease. It's so prevalent that, it's part of standard medical care. Nice if we got ourselves healthy enough that wouldn't be so required these days.
Well, but do you think that when there's an abnormal result, the doctor should begin by saying, don't panic, something like 1/3 of EKGs are abnormal, and
Absolutely.
It could just be the structure of your heart and the way you were born?
Absolutely. The doctor needs to take responsibility. Again, these tests have effects. The very act of testing is anxiety producing to the patient, and you owe the patient reassurance. If it's a benign test, the doctor it's part of good medical care is to relay that. Absolutely.
Yeah, we had a jerk in the urgent care clinic who said you have to go in an ambulance to the hospital. I said the hospital's 5 minutes away. Oh, you have to be in an ambulance. No,
Right.
we're not going in an ambulance. It'll kill her.
Hmm.
What role do you believe healthcare professionals should play in educating patients about nutrition, and how can they be better equipped to do so?
About the blind leading the blind here. The first thing is the doctors need to educate themselves about nutrition, about plant-based nutrition, and they should take the courses at the Plantrition Project. Go to plantritionuniversity.org and go to the American College of Lifestyle Medicine, ACLM.org, and educate yourself. There's little 5-hour courses of nuts and bolts plant-based nutrition that every doctor needs to know. It's free of charge. Every doctor should be taking these courses. So the doctor needs to educate themselves first and foremost. And thank you for that website. Go to plantritionuniversity.org and wander through those wonderful courses they got. It's all online. And go to again, American College of Lifestyle Medicine. Google that and go to their resources section as well. Educate themselves, and then they can educate their patients with everything from handouts. I've got a doctor friend who just keeps the movie Forks Over Knives playing on continuous loop in the waiting room of the medical office. In the evening, they come in the main reception area. They set up a table. They plug in the blenders and the Instapots, and they show their patients how to make salad dressings and smoothies and cook rice, etc. The doctor who wants to get this information across certainly can. And more doctors are instituting this in practice into their practice as part of lifestyle medicine. And I urge all doctors to become lifestyle medicine certified. It makes a big difference.
All right. Unless any other audience question comes in, I'll ask my last question, which is, how do you feel about preventive visits to the doctor? Should people go for an annual checkup? I believe it's the case that in Canada, at least in the past, maybe they've changed, they didn't recommend an annual visit because they did research, and it turns out that it maybe did more harm than good. It led to more unnecessary testing and so forth. And the attitude was, just come in if you have symptoms. On the other hand, I like to get my cholesterol results once a year, get my blood work done, and sort of keep an eye on things. So how do you feel about going for an annual checkup if you're feeling just fine?
Very profound question. When I was growing up, literally when I was a boy, and your annual checkup, go see your doctor once a year for your annual chest x-ray, et cetera, et cetera. And it was part of the given dogma. And then it was in the early 1980s, a bunch of insurance actuaries are saying, wait a minute, this is a physical exam here. By the time you see the doctor, order the test, whatever, it's costing about $400 out of our pockets in the insurance world here. What are we getting for our money? How much disease are we really picking up? How many false positives are we generating here? And it turns out the actual advantage of doing annual physicals is really tiny here, to the point where most of them said, stop doing these annual physicals. If you have any signs or symptoms, if you're getting short of breath, heart palpitations, weight loss, weight gain, go see your doctor for a specific issue. But just to go in and looking for medical problems is probably not cost effective. But like Glenn is doing, what a smart man taking his health into his own hands here. He's got it right, where he went in, go get one good physical exam, and assuming nothing bad shows up, well, then from then on, you can pretty much follow it with blood tests, get your lipids checked, your vitamin D level, your B12 level, etc. once a year. And that's probably all you need. You don't really need to go see the doctor and get all sorts of invasive studies done, or even a lot of these screening tests that involve x-rays, etc. So you can handle it mostly by blood tests.
All right. Well, thank you so much for joining us, Dr. Klaper. Folks can see on the screen that you could go to his website at drklaper.com and movingmedforward.org.
Right.
And thank you all for listening. I have a book on this subject called Own Your Health, which discusses how to take your health into your own hands. And I also have my YouTube channel. So thank you again, Dr. Klaper, and we'll call it an evening.
Thank you very much, everybody. Good health. Stay happy.
This has been the Glenn Mercer Show, where everyone listening turns vegan, regains their health, and annoys their friends and relatives. Find us on YouTube at The Glenn Mercer Show and across all your major podcast platforms. Don't forget to subscribe.